Thanks for joining us today. Welcome to the Center for State's video series on the 7 functions of intervention selection and design adaptation. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Intervention Selection and Adaptation Design Brief is intended to help child welfare agency leaders, managers, and stakeholders assess and select the best possible intervention to address the agency's specific problems. It does this by providing step-by-step guidance to research and assess possible solutions, and then select or adapt an existing intervention or design an entirely new one to meet agency needs. In this module, we will discuss assessing the evidence, fit, and feasibility of possible interventions. As a reminder, teams should have already researched possible intervention options before moving on to determine whether an intervention is well defined, deciding whether to replicate or adapt an existing intervention or design a new one, defining the intervention, developing a proposal, and then further defining and operationalizing the intervention as needed. A successful program for one agency may not be successful in another if it doesn't fit the needs, setting, target population, or capacity of that agency. As teams or sub-teams identify possible interventions, it's important to think critically about whether identified interventions will work in their specific agency for their specific purposes, whether there is alignment with the team's theory of change, and if the intervention might be successful with the target population, whether it fits with the system, agency, and community context, and if the agency and team has the capacity to implement it. The first part of assessment is reviewing the evidence. When considering the research on possible interventions and making the decision to select, design, or adapt an intervention, teams can use their theory of change to find alignment and determine if the intervention is appropriate. For example, will the intervention address the identified root cause or causes? Do the components align with the causal links, conditions, and actions identified as necessary for the change or long-term outcome to occur? Teams may also look for evidence that the potential interventions are effective, and more specifically, how each option will address the needs of the target population identified. If an intervention has outcomes with different population, then adaptation of the intervention may be necessary, and teams will need to collect evidence to develop a sound rationale for why they believe it will be effective and appropriate in their situation. Consult experts, evaluators, and other partners that can help synthesize this research. In the second part of assessment, teams focus on fit and explore whether the intervention is compatible given the agency's system and context. For example, a team might consider, does the intervention reflect the community-based and family-centered values described in the agency's practice model? Will an intervention that was effective in a state with few private contractors work in a highly privatized system? Will a program successful in an urban setting fit in a rural area? Assessing fit is not an exact science, and teams will often need to rely on the best information available. Teams can improve their assessment with a few key strategies. Engage the experts and stakeholders, including family and youth, in assessing the fit of potential interventions. Ensure cultural relevance with those who will deliver the service and those who will receive it. And be open to adapting the intervention, agency, or system to improve the fit. For example, adapting the services of the intervention, or being able to hire and train new staff. When exploring a potential intervention that has shown success in another organization, teams may find that the contextual similarities and differences impact the fit of a specific intervention. These may include state or agency values and priorities, agency practice models and ongoing initiatives, agency structures, for example, whether they're state or county administered, and geographic setting, for example, whether they are urban or rural. Staff skills, qualifications, and credentials, and worker norms and beliefs. community demographics and languages, meaningful target population values, customs, and preferences, and contracting arrangements. When teams consider all of the potential contextual barriers or supports thoroughly, they can make informed decisions about whether an intervention is a match, whether they'll need to make adaptations, or look at other options. The third part of assessment is feasibility. As mentioned throughout the Change and Implementation series, selecting solutions that can be feasibly implemented and sustained increases the likelihood of success in a change initiative. When considering feasibility, teams can review their existing or potential capacity in the following areas. Resources, for example, funding, available staff with the appropriate qualifications, and technology. Infrastructure, for example, policies or internal systems. Knowledge and skills, for example, all of the related competencies. Culture and climate, for example, leadership commitment, the agency values and norms. And engagement and partnership, for example, internal and external organizational relationships. Does the intervention seem reasonable given the requirements in these areas? If there are areas that are not fully capable right now, does it seem feasible that resources could be allocated to get there? Teams should consider the following questions when researching possible interventions. Are there research and evaluation findings linking the intervention to outcomes of interest? What are the strengths and limitations of that research? Is there support based on practice experience? How will the intervention address the target population's needs? Is there cultural relevance? For example, does the intervention match the values and preferences of the target population and also the individuals delivering services? What supports or changes might be needed? Does the agency have the capacity to implement the intervention? Can the agency build the capacity to implement it? Answering these questions as a team will help to assess which interventions might work in their context, find the right balance of fit and feasibility, and gather enough supporting evidence to make an informed decision. Let's take a moment to talk about an example. After thorough exploration and analysis, the Illinois Department of Children and Family Services went through a structured process to select a trauma-focused intervention to support the goal of reducing long-term foster care. Through the process, they discovered 4 key takeaways. First, relevance to target population needs. Through research, the Illinois team identified risk factors for long-term foster care, including age, previous placement instability, and mental health issues, and trauma symptoms. The team has identified its target population as youth ages 11 to 16 who had been in foster care for 2 years or more and were experiencing mental health or trauma symptoms and/or placement changes. Through their assessment, they found a model with strong evidence for effectiveness among adolescents with complex trauma. Second, alignment with the project's theory of change. The team's theory of change suggested that educating youth, their biological parents, and foster parents about trauma and coping strategies would lead to improvements in healthy functioning. These improvements were expected to stabilize placements and promote relationships, which in turn were expected to improve permanency. The identified model fit the theory of change and addressed 3 barriers to permanency. 1, youth's needs to control their emotions and reduce the severity of trauma symptoms. 2, foster parents' knowledge and skills to respond to the needs and behaviors of youth in their care. And 3, biological parents' skills in regulating their emotions and behaviors so that they could engage in services and address underlying issues. Third, fit with agency culture and values. Both Illinois' practice model and the identified model emphasized family-centered, trauma-informed, and strengths-based values. And fourth, strong theoretical basis for adaptation. While the model was not developed for or evaluated on improving permanency outcomes in child welfare, research suggested that using the intervention in a family therapy model with biological and foster parents could support increased reunification and legal permanency. The team determined that they had the capacity to work with developers to adapt the intervention to be a better fit with their specific need. It sounds like the team has completed a comprehensive assessment of the evidence, the fit of the intervention in the system, agency, and context, and have considered the feasibility of implementation. Let's take a moment to check in on what you've learned about assessing the evidence, fit, and feasibility of an intervention. Why do teams assess evidence, fit, and feasibility of an intervention? To have a clear understanding of the potential for success with the target population, the fit with the system, agency, and context, and the capacity needed to implement it. How do teams assess evidence, fit, and feasibility of an intervention? By assessing alignment with the theory of change, looking for evidence of effectiveness with target population, and assessing fit and feasibility. What can help teams assess evidence, fit, and feasibility of an intervention? Identifying the strengths and limitations of research available, ensuring cultural relevance, and gaining a clear understanding of need for adaptation and capacity to implement. Now take this a step further by reviewing the reflection questions and practice exercise for assess evidence, fit, and feasibility of an intervention in your intervention selection, adaptation, and design workbook to connect what you've learned to your own experience. Up next is determine whether interventions are well defined. Are they usable and transferable? The third function in intervention selection, adaptation, and design.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.